The dead are making way for those in need of intensive care. Good evening, I'm Tara Overholt. The president of AHS explaining that one of the real reasons there are ICU beds available for patients these days is because people are dying.
The average number of COVID ICU admissions have been more than 23 per day. It's tragic that we are only able to keep pace with these sort of numbers because in part some of our ICU patients have passed away.
You can hear the emotion in Dr. Verna Yu's voice, the frustration and exhaustion as she relays what Alberta doctors, nurses, and healthcare workers are dealing with.
And this reality has a deep and lasting impact on our ICU teams.
Yu says without the surge beds created over the last month, Alberta's intensive care units would be at 179% capacity. With those extra 177 spaces created, we sit at 89% capacity, 1% away from when triage protocol sets in.
Every day, the teams are working so hard to create additional capacity so that we actually don't have to move to the steps of out of province or having to bring people into the province or, as a last resort, the critical care triage.
Taking a look at the ICU numbers, we have 350 ICU beds total in the province. Right now, 310 of them are in use. 226 of those patients have COVID.
100% of new ICU admissions were in Albertans who did not have any vaccine protection.
1,058 people are in hospital with COVID right now. That is 18 more than Wednesday. 1,660 new cases were reported in the last 24 hours from roughly 18,000 tests for a positivity rate of 9.4%. 17 more Albertans have lost their lives to COVID, and 73.2% of the eligible population is fully vaccinated. In Calgary, Tara Overholt, City News.